Good morning, everyone, and welcome to the Perley Health CEO Town Hall. Thank you for taking the time to join us today. I'm Jay Innes, the Director of Communications. Perley Health CEO Hoffer will be sharing important news and updates since our last Town Hall in October 2024. The video of today's Town Hall will be available to view on the Perley Health website. Before we dive in, here are a few housekeeping items to keep in mind. This is new technology for all of us, so we thank you for your patience and support as we work through the delivery with this new platform. If you have questions, please type it into the chat function, and we'll do our best to address it following the presentation. We ask that you help maintain a respectful and inclusive environment for everyone. Thank you. Over to you, Akash.
Thank you, Jay, and thank you, Tom, for making this possible. And welcome, everyone. Thank you for taking the time to join us this morning. Before we dive in, I'd like to introduce three of my colleagues, Tanya McDonald, Katrin Spencer, and Laurie Stuckless, who are also in the town hall today to answer questions that may come up later. And before we get into the presentation itself, I also want to take a moment to really say a special thank you to our volunteers, our staff, and our donors. And really, it's a thank you on behalf of our veterans and the seniors. I want to say thank you because you are the ones who really make us who we are. And speaking of volunteers, I'm thrilled to let you know that our volunteer ranks have reached an all-time high of 430 volunteers. So we have about 900 staff plus an additional 430 volunteers, which is phenomenal. And again, you are the ones who really make us who we are. So thank you. In terms of today's town hall, usually I try to follow a cardinal rule of keeping things simple and maybe limiting the discussion to like 3 topics and maybe going pretty deep on each one of those. To be honest, we can't do that today. There's just too much that's been going on since our last town hall in October of last year. I feel like we've gone from 0 to 60 in a very, very short time. And so what I'd like to do today, if you'll bear with me, is just touch on quite a wide range of topics. And as always, our website is there to give you more information. You'll see that there's lots of opportunities coming up to engage, to give input on specific initiatives and so on. But again, thank you for joining us. I do think this is important. There's a lot going on outside our walls, and that's impacting what's going on inside our walls. And so the opportunity to communicate directly with you is more important than ever. So I can't see what slide we're on, but there we go. If we go to the next one, Tom, please. I want to take a moment just to talk about growth and the demand for what we do. And it's very interesting because over the last 10 years, very quietly, the population over age 85 has doubled. And I got that data from the Ontario Long-Term Care Association. And I've been kind of sitting here always saying, it's going to happen. It's going to double. Well, it just did. And that's part of the reason why we've tried to grow over the last several years. But the real news today is that it's about to happen again. So the group of seniors in Canada, in Ontario, in Ottawa, will again double in very short order. By the early 2030s, we're going to have double the number of people over age 85 than we have today. And so when we talk about some of the changes that are being considered and being pursued and that we're spending money on and taking risk, that's a big part of the reason for us to remain relevant to the health system and to our stakeholders. We need to try to keep up. And what we don't want is to become an ever increasingly exclusive club for the lucky few who can access our services. That's not good quality. A key measure of quality is the ability to access what a health service provider like Perley Health does. So that's why if we go to the next slide, please, we have been working very hard at expanding the accommodations, so the long-term care and the apartments that we provide on our campus. This started, some of you may remember, before COVID, and we were making public announcements back in 2019 about a new building that we had planned for the campus. And then, of course, COVID hit. So that put a stop to really almost all of the planning. We always had it in the back of our minds, especially since as the years have gone by, accessing housing is harder and harder for everyone, not just seniors, but for everybody. And long-term care, the long-term care wait lists here, I remember when we had, I don't know, 400 people on our waiting list. Today we have 1,200 people waiting for a long-term care bed, which in practice, what that means, very unfortunately, most people will never get a bed here. And so the Ministry of Long-Term Care has been working very hard to enable growth, to provide funding, and hopefully to make positive policy changes to make expansion and the addition of new long-term care beds possible. And we're part of that. So we've been working hard at identifying a location where we could add both seniors housing, so apartments, and long-term care. It's not easy because there's not a lot of space on our campus that is free for that kind of development. But with the help of our consultants, we have identified a location that you can see on this satellite photo near the Gatineau Link. So the left-hand side of the photo is the western edge of our campus, and there is space in there for a couple of very slim buildings to go in. So one of the key things that we are very intent on doing is that as we add new infrastructure, new buildings, new accommodations, as much as possible, we'd like to see those connected in to the facilities that we already have so that people can stay indoors if they prefer to, and that it makes it easy to access all the amenities that we have here. So new long-term care, new apartments, a lot of planning work, a lot of design work is underway. So what that means is that we will be coming to you for input. We will be doing consultation with you, as well as with the City of Ottawa, the Ministry of Long-Term Care, and of course our foundation. Timelines, very, very difficult to predict. There's the planning, there's the fundraising, and then there's the approvals process, which when you build, especially long-term care, can be granular, detailed, dare I say, onerous. And so we are going to be working very hard to make that efficient and hopefully bring something online as early as 2029, which still sounds a long way off, but in terms of development and construction timelines, that's pretty quick. That's only 4 years from now. So stay tuned. There'll be more news coming up on that. And again, part of our website, if you go in and look at seniors living expansion on one of the drop-down menus, you'll see there's a dedicated section of our website for more information as it becomes available. So
hello, everyone. Thanks for your patience. We seem to have lost Akash. Maybe he was checking out the actual site. I'm not quite sure, but we're going to reconnect with him and bring him back. We are moving to the next slide, which is the strategic plan.
Hi, Jay. I'm back.
Oh,
can you hear me?
Okay, he's back. Yep. Thank you.
Sorry about that. I got dropped. Okay, strategic planning. So thank you. Yes. Hopefully you can all see that slide. What you're looking at there is hopefully something that you've seen in the past. This shows this really shows how we got to where we are today. And if you're new to Perley Health, it may be easy to assume that we've always been here and that the amenities that we have today have always been here, but they've come in a bit at a time over the years. And the key document that has guided us in that is our strategic plan, which ran originally from 2010 to 2025. It's a document that we've updated a couple of times over the years, but the core of the plan has stayed the same in terms of these three phases. I don't want to walk through that, but I just want to say how important having a framework like this has been to getting to where we are today. So I'll just pull out one example here. Back in 2010, we knew that we wanted to establish a center of excellence, even though that goal was like 10, 15 years out. But what that meant was we could start planning for it. We could start building relationships with educational institutions, with researchers, and so on. We could start a fundraising campaign. All these great things were possible because we knew the goal was on the horizon. And as time has moved on, we've achieved a great deal. You can see it listed here on this slide. So the question now is, what's next? And what that means is it's time for a new strategic plan. And really, the way we think about strategic planning, before we get into the plan and what we want to be and what we're going to have on our campus and how we're going to change, we need to think long and hard about what life and our environment and our city will look like 5, 10, 15, 20 years from now. And once we have a good handle on that, we can start to think about how does Perley Health fit into that situation? How can we bring value? How can we continue to serve veterans, seniors, and others? So that work is just starting right now. And again, there will be opportunities to provide input. We're going to have focus groups for staff. We're going to have online surveys and so on. And to make this plan, to get it right, we really need to hear from you. And we've had a couple of preliminary meetings, and the input and the feedback that we get, there's always stuff that you just would have never thought of. So I really encourage you to get involved when you see the opportunity. So if we move to the next slide, which is called Looking Ahead, really, when we talk about strategic planning, what we want to do is come up with solutions. I think part of the environmental scan and the work, the preparation work that we do for strategic planning are going to show that there are a lot of problems. We know that there's a lot of problems with the health system. We know that some of those are going to get worse. We know that government is getting really stretched when it comes to revenues. We know that there's fewer and fewer human resources available. We know that the population is aging, all these kinds of things. But we need to come up with solutions. And that, again, is where we encourage you to get involved so that we can have a strategic plan that is solutions oriented. We can take that plan, we can start talking to government, we can start talking to partners, we can start fundraising, all these great things to keep up with the pressures in the health system and to keep Perley Health at the cutting edge of what we're trying to do. So all of that speaks to impact. What we want to do is have maximum impact. So if we go to the next slide, if we look back over the last year, normally around this time of year, we release a community report. What we wanted to do this year is publish a document that really focused on impact. And I want to congratulate Jay and the comms team for making this possible. What you see on the screen are two documents that are combined into one. One is the community impact report that really highlights the difference that we've made to the health system and especially to the people that we serve. And the other side of that report speaks specifically about the accomplishments and the plans of the Center of Excellence. So I really recommend picking this up. There's copies all over the place at Perley Health. It's also available online. Very importantly and creatively as well, there are QR codes embedded in these reports that will take you to video stories. For example, Bob and Gail Christie, resident and tenant of ours, shared their story. And if you watch this, you will really get a sense of what life is like at Perley Health. There's a number of other stories included as well. So I really want to thank everyone who's participated in terms of the Community Impact Report, also the People of Perley series. You bring our stories to life. We know that our audiences are looking for video content. My voice won't hold up long enough to do all of it, so I really appreciate your contributions and your vulnerability, because when you go on camera, there's an element, you're taking a risk and you're sharing your own very personal story on camera, and then it's out there. And but again, you're really helping us, and I really, really appreciate it. It's very important to us. So moving on, if we look at our facility here, you wouldn't know it, but the building I'm sitting in is turning 30. It was 30 years ago, there was no building here. And because of the work that we do here, the care that we provide, and the number of people who come and visit, there is a lot of wear and tear. So I really, really want to acknowledge the hard work and the foresight of our support services team and our finance department, because we have known for a few years, for example, that the roofs on our buildings were coming up to end of life. 30 years is pretty much the outer limit for a roof. And sure enough, as some of you know, we were getting leaks. We're still dealing with some of those. With a flat roof, it's very hard to know exactly where the leak is coming from. So obviously, it's something that we had to tackle. Last year, the first roof replacement went ahead very successfully, on time and on budget, all those good things. So the Gatineau residence has a new roof. As some of you may know, the Ottawa residence is currently being renovated with a new roof. The Perley Centre also this year will be completed. And then next year, next summer, we'll see work on the Rideau residence. So it's not just the roofs, it's everything. If you look around, slowly in the background, we're renewing everything. It's almost like you're rebuilding the whole place as time moves on. So a lot of the mechanical equipment that keeps us comfortable here, warm in the winter, cool in the summer, a lot of that has to be renewed, replaced, maintained. A lot of the flooring, a lot of the furniture, all these kinds of things. And you can go and visit other healthcare organizations that don't have the kind of support that we have here. And you notice the difference. And it can be very depressing. And that is not what we want here. We take great pride in our facility and also the care that we provide here. So again, thank you to everyone who makes that possible. I want to focus in on a few people who are the recipients of nursing scholarships, if we go to the next slide. So here you see the smiling faces of Kamal, Musanda, and Piper. So congratulations to all of you. I don't know if you're on the call today, but these are recipients of nursing scholarships. So these help provide learning and career options to our staff. Again, this would not be possible without the support of our donors and our foundation. So I want to say a special thank you to Claude Chapdelaine and Susan Davies, both of whom provide financial support. Susan especially knows the importance of this, as she worked as a nurse for many, many years. So thank you for supporting our nurses to help advance their careers. Super excited. I did plenty of on-the-job continuing education myself. It's not always easy to juggle learning and work, but it's well worth it. It always pays off and makes work even more rewarding than it already is. So let's go back to talking about the future for a moment, and children and seniors. So as hopefully all of you know, we've been investing a lot of time in planning our intergenerational on-site early learning and care center. This is a partnership with Andrew Fleck Children's Services. Very briefly, our plan is to renovate and expand the space across from the pharmacy in the Perley Center to provide intergenerational care for 49 infants and toddlers. So this will be a custom-built space, really the first of its kind in Canada, that is custom designed right from the beginning to accommodate seniors who may be in wheelchairs and using other assisted devices, but also children. So we've not seen this kind of thing before. When you walk into a daycare, usually what you see are the tiny little cubby holes and toilets and so on. This will be much more. It needs to be safe for all of us to visit, participate, get involved, and enjoy the children who will be cared for here. There will be spaces for 49 infants and toddlers. Again, timelines can be difficult to nail down, but our aim and our belief is that we'll be opening our doors in mid-2026. So in the run-up to that, we ran a survey, and I want to thank all our staff who participated in the survey because we always learn a lot from your input. And it seems like we are aligned with the needs that are emerging. So staff told us they're looking for childcare for children from infancy to age 5. So that's in line with the plans that we're making. And we also learned that about 2/3 of the respondents require full-time care, while 1/3 require care on the weekends. So this really helps inform our plans. There will be more information. A lot of what I'm talking about today, there really isn't a ton of detail and a ton of information. So for example, on the intergenerational childcare center, once we get our plans finalized, which hopefully will be in the coming weeks, then we'll be in a position to make like a very concrete announcement, and then we'll start making more detailed plans and doing more engagement. But again, visit our website. There's frequently asked questions about wait lists and all those kinds of things, how to sign up. Again, I want to single out the foundation. They started very early, almost a year ago, by sparking the Bridging Generations campaign. So this is the fundraising campaign to support this expansion. There is government funding for childcare expansion, but it doesn't pay for what we need, which is an intergenerational space. It just is going to cost more. That's the way it is, and that's where our donors come in. So thank you again. A few more areas to cover before we turn it over to you for questions. So our short stay programs. These include the day program and the respite house. These programs are designed to support people who are living in the community, that living at home with their loved ones, and we're trying to support those with mild to moderate dementia and to support their caregivers especially. We're very proud of these programs because they allow us to reach out into the community and help keep people at home for as long as they want to stay home. And I want to take a moment to acknowledge and thank Care4. Care4 is a senior services agency here locally that has been supporting these programs, one of them anyway, for 25 years now. There's a transition that is taking place, and Care4 will no longer be providing that service, but what we're going to do is enhance the service and provide it ourselves. So our staff will be working in these programs now. Both programs also will be provided and operated out of the Respite House Bungalow. So as you can see, that's building number 5 on our campus. This will allow us to combine the programming and also provide outdoor access. There's a courtyard, a very nice space behind the Respite House Bungalow. So when the weather is cooperative, like it has been lately, then clients can enjoy that space, whether you are a subscriber to the Respite House or the day program. So that's an important change. And what that has done is it has created space in the Perley Center where the day program used to be located. You may have noticed that space is vacant now, but not for long. If we move to the next slide, we, about a year ago, applied for something called a Seniors Active Living Center. That is Ministry of Health terminology. We are going to have our own name for this in due course. But really what these programs aim to do, again, is to reach out into the community to connect with seniors who live in the community and are really looking for investing in themselves in the form of healthy aging, making sure that they're getting the social contact that they need. It's not always easy. It doesn't always happen on its own. For some people, lifelong learning is a real interest. So this program, the Seniors Active Living Center, will provide all of those opportunities for physical fitness, training programs, and so on, all custom designed to meet the needs of seniors, to benefit from all the expertise that we have on our campus here as well, and especially to target the care of veterans who are living in the community. The programming will be available to everyone, but some of it will be specialized to meet the needs of veterans. Because again, that is part of our legacy. It's a commitment that we're sticking to, and we want to make sure that veterans know about us, that they're engaging with us. And soon we'll have an open house and some tours available so you can learn more. And as always, you can look online for more information. So before we wrap up, I just want to highlight a celebration that we had, I guess last week or the week before. We had a Century Club celebration here, and what a positive and enjoyable party that was. We celebrated 20 of our residents who reached age 100. My grandmother lived to be 100, and I can tell you she would have loved to have been part of something like this. 10 of the centenarians were veterans. And I just want to say directly to those centenarians and to all of our residents and tenants, what an honor it is to serve you. You all have fascinating stories, and we are very, very proud of the care that we provide. So those two ingredients, those stories and the care, really caught the attention of the national media. So I want to especially thank Jay and his whole team for engaging with the media. You may have noticed there was a ton of coverage, and very positive, very important to us to create awareness of what we do here. It helps us in many, many ways. I also want to say a special thank you to Michelle Prue and Rachel Dobson. Michelle and Rachel, thank you, and the entire team from the Ozardinch Grimes Family Therapeutic Recreation and Creative Arts Program. Your hard work and dedication and careful planning made the event a huge success. So thank you for that. And with that, speaking of Jay, I will pass it back to you now for our Q&A session. Again, we have Katrin, Tanya, and Lori on the line. And together, hopefully we can answer any questions that you may have. Thank you again.
Thank you, Akash. And we invite all questions to be submitted into the chat. And I do have a few here that I might use to get things going. The first question is about community programs. Can you provide more specific details on the timeline for the launch of the new Seniors Active Living Center and full transition of the Enhanced Community Short Stay Program at Respite House?
Sure, Jay.
Yeah, thanks, Tanya. Go ahead. Sorry.
Thank you both, Akash and Jay. Great question. So we are looking to transition the short stay programs, which is the adult day program and the overnight respite, as of July 18th, where we're offering that integrated care. And for the Seniors Active Living Center, we will be launching in July, so soon, and we hope to launch with a public event so that you can all come visit the space, have a tour, and then see what we're offering in terms of programming. So look for more information on our website and social media channels shortly.
Great. Thank you both. The next question is about the new strategic plan. With the new strategic plan being developed, how will Perley ensure that the diverse feedback is gathered from staff, volunteers, residents, and families, to help shape the plan's direction and priorities.
I think we have Katrin on the line. I just want to say, to me, this is another really important question, because at the end of the day, we want all of you to see your concerns, your ideas reflected in the plan that we develop. We don't want to do this in isolation. So, Katrin, I guess the question is, how are we going to do that?
Thank you, Akash. And another great question. Yeah, we're going to engage everybody really from upper management all the way to frontline staff. And how we do it is we are planning to do multiple focus groups, really with the diversity of staff. We're going to do focus group with residents, with tenants, with volunteers, families, caregivers. So really, we are planning for about 11 to 12 focus groups. We also have the opportunity for anybody who can't make focus groups or is not comfortable provide written feedback. We're going to launch a survey that will be shared on our website and through Jay as well, who sent out an email. And in addition to that, there will be also coming in the Perley Center some, I would say, our trade show booth in the health center in the middle, like close to the foundation. We'll have some exciting engagement as well, where everybody who walks into Perley Health and walks out of Perley Health or visits can participate. And there will be multiple actually interviews as well with external stakeholders as well. So we're really doing a really broad engagement from everybody within Perley Health's community, but also outside, our partners, funders, external stakeholders.
Great. Thank you both. Another question, and it may fall on Katrin, and it's given the significant campus expansion project and ongoing roof replacement, what measures will be in place to minimize disruptions and ensure safety and well-being of residents, tenants, and staff during all this construction?
Always an important question when it comes to construction. I mean, what Perley Health is committed to is we are going to implement measures to ensure safety and really minimize inconvenience for everybody on campus and in the neighborhood. We will have transparent communication about any noise disruption, traffic disruption, etc., that will be going on. I will say as well, though, transparently, when it comes to construction, while we're putting every mitigation possible in place, construction will be noisy at times. It will be dusty. That's just the nature of construction. We do have a goal in mind. We want to expand and really provide services to more people in our community. So we're going to work as hard as we can to minimize as many inconveniences and disruptions that we can. At the same time, we're being transparent. There will be disruption. Thank you.
Great, thank you. And I've got a question that's just come in the chat, and it says, thank you for the briefing. Does Perley Health have any formal connection to the City of Ottawa Veterans Task Force? It might be relevant to Perley Health plans. And Akash, Katrin, do either of you want to pick that up? I know you've had some engagements with that group.
Katrin, do you want to go ahead?
Yes, thank you. Yes, it's a good question, and it's a really important group that we at Perley Health actually started to engage with just about, I would say about a year ago. We had a couple of meetings on site with representatives from the task force, and we're basically now engaged and kind of in the loop what's happening, and we want to be more involved. Veterans is really one of our core audiences at Perley Health. It is our legacy, and we want to ensure that we continue being engaged and offer services to veterans that are in need. And really through the Veterans Task Force, we also were able to identify where are the current gaps for veterans, really in the continuum of care. And Perley Health is looking really to work with the task force as well to help fill the gap.
I'll just add to that, Jay, as well. When it comes to strategic planning, that's a really important input, and it's a really important question, because when we did the 2010 to 2025 plan, we knew that our core veteran population was going to decline, and that was our World War II and Korean War veterans. So there's been a lot of positive policy changes at the federal government level, where we're now able to welcome all kinds of veterans, whereas in the past it was very restrictive. The question now is, what's next? How do we continue to serve veterans? What should that look like? So when Katrin talks about gaps, it's really important input, and that's why it's a good idea for us to be engaging with groups like the task force. Thank you.
Great. Another question that seems to lean into the Center of Excellence. This presentation highlights a daunting challenge with the dramatic increase in seniors and veterans living with frailty in the future. What specific innovations or new models of care is Perley Health exploring to meet this growing demand and remain a leader in frailty-informed care?
I can speak to that to an extent. I think really we maybe next time we should have one of our researchers online here, but of course we're always doing webinars from the Center of Excellence as well. Some of the care, some of the research and some of the best practice is really focused on the bedside care that we're providing. So if you think of, for example, CME, this is a program that we have here that really aims to understand the needs and the preferences of our long-term care residents, and to support their substitute decision makers in some cases with very difficult decisions along the way. So it's making sure that their care plan is tailored to meet their needs, and then if there is a health crisis, responding in a way that really respects the needs of the residents. That is not automatic. So if you look at other long-term care homes, if you look at hospitals and other organizations, some of them do a version of this, but not all do. And so there's a huge opportunity to support organizations to implement a great practice like this. So that's one example. The other one that we always hear and that we're always curious about is, how can technology support any problem that we have in society? And if we don't have the resources, if we don't have the money, enough money, people, and buildings to support seniors, how can technology come in? So there's, whenever technology is introduced, you need to ask some pretty basic questions first around safety, around ethics, and all those kinds of things. So one grant that our Center of Excellence applied for very recently is to establish an ethical framework for the use of artificial intelligence in long-term care. We see the opportunity to be a leader in that area and to really engage with technology companies to say, like, you're welcome here, and we need to make sure these considerations are taken into account. So those are just a couple of examples. There's other really important work going on around, again, technology and adapting it to this setting and making sure that it works, and then it can sort of take off from there. So there's just a couple of examples to share.
Great, thank you. We're at 10:40. I've got one question here on parking that I'm just going to pose, and I'm not seeing any other questions at this time. So Akash, Katrin, Lori, the question is, with the plans for a new building, how will this impact parking?
Who would like to?
I can start.
Yeah, I can, sure.
We can tag team. Actually, Lori and me just had a meeting yesterday on parking. So it's definitely front of our minds when we expand long-term care and housing. That means more pressure on parking for staff, parking, volunteer parking, visitor parking, and for the housing, also tenant parking. While the design has built in additional parking already adjacent to the building, we know more parking is needed. And Lori Sackler, our Director of Support Services, has a plan in mind already that she can share where there is more opportunities on campus to add additional spots. In addition, though, I wanted to share, we also just finished another parking study with a consultant company. And that company really looked at, when are our peak times, when is our parking lot utilized 100% or maybe overutilized? And how can we also, from an operations perspective, mitigate the parking pressures? So we're really looking at structurally mitigating parking pressures, but also from an operations perspective. And I'll pass it on to Lori to add on to that.
Thank you, Katrin. Yes, parking is a huge concern here at our campus. You will also notice throughout the years, we've been also making changes to some of the parking spots that we have on our campus. So last year, we added an additional 15 parking spots on our campus, and we are continuing to look at our space and allocating the space accordingly to take advantage of additional parking spots on the campus with the future growth and development. So as Katrin has indicated, Katrin and I are currently working on a plan and working through all of the regulatory requirements to ensure that we can enhance the parking spaces as we plan for the future growth and development on our campus.
Great, thank you both. I mentioned that we were at our last comments and questions. Well, that triggered a few more. So we still have some time in front of us. One is a question, and whoever, Akash, can pick it up. It's a quick one, easy one. Does Perley Health have a horticultural therapy program? If so, how large is it?
My answer is yes. I'm not sure how to answer how large it is. Can one of my teammates support with that?
I'm happy to pick that up. Sarah Shapiro is a horticultural therapist. She does an amazing job. All of the greenery you see around Perley Health is attributed to her support, as well as Lori's support services team. And quite impactful, a favorite of ours for photography and involvement in supporting the Therapeutic Rec and Creative Arts program. That's about all the information I have on the scope of it. We will move to a comment as we wrap this up. Oh no, I've got another question here. Has anyone looked into a shuttle from Herdman Station to encourage transit use?
Interesting. Yes, looked into. We spoke with Pat Scrimgeour from OC Transpo a while ago, and kind of discussed that link. I wish it was shorter. I wish it was quicker. It's kind of an awkward route because it goes around Canada Post on industrial. There, the OC Transpo's position basically is that it's actually pretty efficient. They can look at the departure times and that kind of stuff. But we know in practice, when you try to use that, it's not as smooth as it could be. You're often waiting for quite a while for the bus to come. Part of that, as we understand it, staffing is always an issue. And OC Transpo doesn't always have its full complement of drivers staffing all their shifts. So there's not enough buses running sometimes. So we've looked into really what we've done is tried to advocate with OC Transpo to increase service. That's really not forthcoming. I don't think it's possible for them. Where we take it from there, I mean, it could be a shuttle. I think it's worth, I appreciate whoever raised the question, because I do think it's worth considering again, just to see how we could ease. We're not right at the train station, so obviously that creates a problem. Thank you.
Great. And with that, I will end with a nice message from Laird. And it says, thank you to all the staff for doing such a great job. And I think that's probably an appropriate wrap. Unless there's anything else. I don't see any more incoming questions. We may be able to give everyone 14 minutes of their day back.
Thank you, Laird, for the comment. And thank you, everyone, again for joining. Have a great day.
Thank you all. We will have another town hall in October, and there'll be plenty of information coming out as we move forward. You'll also be able to access this town hall as a video on the Perley Health website. Thank you again. Have a good day.